I'm going to try to be respectful of your time. John Payne may be joining us in a little bit, and when he pops in, he wants to say a few words, and so I will turn it over to John at that point, and we can go ahead and start. So this is our director's call for this week, and our agenda on the next slide says that we're going to talk about a couple of updates, some accessibility information, teleservices, ways to document evaluation, reevaluation, contracts, and then some news that I found to be extremely, excuse me, extremely good news, and we'll go from there. So updates have to do with the information that went out, I think, yesterday primarily about graduating seniors. Just a reminder to your folks to complete summaries of performance for any student that you anticipate will graduate. That information, if you did not get it directly, should be on the South Carolina Department of Ed website. As part of that, there was the reminder that there will be no SC Ready, SC Pass, end of course, 4K or alternate assessments administered this spring. There is still some sort of conflicting information about the mandatory retention that's tied to Read to Succeed. Although the guidance did state that it was based on performance on the ELA portion of the SC Ready, that has been suspended, but also contained the reminder that retention at any grade shouldn't be based on just one assessment, but a collection of data, including formative assessments, teacher-made assessments, quarter grades, and that anyone that was considering retention should have started that process and have notified parents. All right, next slide. Our resource page has been updated off of the Special Ed Services website. Okay, I'm going to pause just a moment. John, if you will unmute yourself, please address the group. We have approximately 155 folks, so it's just a small audience.
Well, can you hear me okay, Becky?
Yes.
Okay, well, good afternoon, everyone. I just wanted to jump on very quickly and say hello to everyone. I was able to participate virtually in the Virtual Advocacy Day for Access and Independence that is hosted every year, and just wanted to take a quick moment to say a couple things. One, thank you so very much, and for all you're doing. It's been, I mean, literally heroic efforts on the part of all of us working together. You know, I think about the Johari window, and we just don't know what we don't know. And so I just appreciate all of the hard work that you're all doing across South Carolina to figure this out. I also want to take a moment to give kudos to Becky and her team, really trying to have, and I'm sure she shared, you're seeing on the slide now, a dedicated special education page related to COVID-19 and special education. And just, again, want to commend all of her staff for the many late hours as we're trying to put together resources, information, answer questions. And a lot of this we're just going to have to feel our way through. And so I just wanted to acknowledge, just how hard they've been working and thank them publicly. In addition to thanking all of you for your hard work, we're going to get this figured out. And I think while at the same time we're figuring out, the daily trying to figure out the questions to even ask and the solutions to them, that if and when this kind of thing would have happened again, I hope we're just a little better prepared. So just know that we're here, know that our commitment on the part of Superintendent Spearman and myself has been consistent with everything we've said for years, is we are committed to ensuring that all students have equitable opportunities and access to digital learning. and just it's our responsibility and opportunity to think creatively about what that looks like. But we are not in a mode of looking for problems. We're in a mode of trying to find solutions and helping you figure out what you need to figure out. So we are available. I'm always available. If you have questions for me, please feel free to let me know. And again, thank you all so very much for all the hard work. It's really amazing. I see pictures of parents and children learning in homes. I see videos of teachers driving through neighborhoods, waving at their students, and it's just stunning. And again, I just wanted to say thank you to all you special ed directors and your staffs for their hard work, and acknowledge the hard work that our special ed staff at the department are doing. That, Becky, that's pretty much all I wanted to contribute.
Thank you so much, John. We really appreciate it. And this is truly a collaborative effort on the part of everybody throughout this. So I wanted to, as John mentioned, we do have the dedicated resource page. If you will check it frequently, kind of get into the habit of checking it, we are posting resources under different categories: resources for parents and students, resources for faculty and staff, for teachers, and then the frequently asked question responses have been organized into categories. We will be adding to those and updating those frequently as we go along. Okay, next slide. So if you don't, in all of your free time, if you don't have anything else to do today, or when you've got about 30 minutes of time, I would encourage you to go to and download this presentation. This was done for the National Association of State Special Education Directors. And I have found it to be by far the most helpful presentation and information that I have seen yet. It comes out of, no surprise, the University of Kansas, and Kelly Ortiz is the main presenter. We will send out the link. We'll post the link for this on the website, but it'll also be in the PowerPoint that I send out at the end of the presentation. This had just great common sense, easy to access information, and how to look at considerations for accessibility and FAPE. So I wanted to give this resource. And again, if it's about a 30-minute presentation, the PowerPoint slides are included in it, but just has great information in it. All right, next slide. Telehealth, telepractice, teleservices, teletherapy, whatever we want to call this form of service provision, has been a big topic. We've gotten lots of questions about it. And if you're looking sort of for a one-stop shop, the Early Childhood Technical Assistance Center, fondly referred to as ECTA, has a great group of resources around telehealth, telepractice, teleservice. So I think I mentioned last week that there are 2 National Technical Assistance Centers that have been designated as sort of the coordinators of all information. For early childhood, that's the ECTA Center. And then for school age, pretty much, that's National Center for Systemic Improvement, NCSI. And we'll put that link in the chat box shortly, but either one of those websites has a great and well organized group of resources. But information that I'm going to go through quickly in just a minute on telepractice and teleservice, it can be found on the ECTA website. Next slide. We talked last week about the fact that pretty much all of the national and state organizations are on board with telepractice or service delivery through virtual means. Our South Carolina Board of Examiners in Speech Language Pathology and Audiology, and SCISHA, our state organization, have both endorsed the guidelines that were developed by the American Speech Hearing Association. And the board has made a strong statement saying that it does not believe it's unprofessional conduct for licensee to utilize telepractice. And that's kind of a convoluted way to say telepractice is fine, as long as the initial evaluation is conducted in person. So we'll talk about initial evaluations kind of toward the end, but so our speech language folks are on board with this. Next slide. You'll see that our Occupational Therapy Association is on board with it as well. That our South Carolina Occupational Therapy Board supports continued service provision through any method of practice, including telepractice, and that they continue to update their guidance on their website as all of this goes out. On the next slide, you'll see that the Physical Therapy Association has done the same thing. We know that one of the issues or one of the questions has been, can districts bill Medicaid for telepractice? We understand that that there have been conversations at the state level about Medicaid broadening again at our state level, because this is a state-by-state decision, broadening or at least allowing some flexibility with this, and we're looking for guidance any day about that. Don't know whether the guidance would provide flexibility here on out or only as long as we're under some of these executive orders. But as far as the licensing agencies are concerned, that's fine, Nicole. Physical therapy, occupational therapy, speech language therapy, the licensing agencies are fine with it. All right, Carolyn's going to talk with us a little bit about a survey that you'll be getting.
Okay, good evening, everyone. I know that most of you completed surveys for your emergency learning plans, but we felt that there were additional information that we needed to capture that wasn't necessarily captured as clearly as we would have liked for it to be in the other survey that you completed. So those questions would be: are you providing access to general ed instruction? Yes or no? Are you providing specially designed instruction? Yes or no? And with the specially designed instruction, and if so, how are you providing those documentation? What provisions do you have in place? Are you providing related services? And if so, what are those related services that you are providing to those services as best you can during this time? And how are you documenting those services? And that would be whether you are using email, Enrich, PowerSchool, Excel, PCG, which is Public Consulting Group, or some other form of documenting what you're doing with your students. Do you have a means of contacting the parents? Next slide. How are you measuring progress towards annual goal? And so this particular portion of the survey is going to be more of a open text box, which means that you'll have to do some typing to tell us what those measures are that you are using towards addressing progress towards annual goals. And the last question that we thought would be helpful not only to us, but to maybe other districts as well, is what resources or tools that you have found during this time to be helpful. Because we've had to be pretty creative with things and measures of delivery. So as Becky stated earlier, the survey link will be found. You will be able to find that on our special education landing page. And you can complete that survey. It is due next Wednesday by close of business. If you have any questions, please feel free to reach out to us. And also, for those of you who had issues accessing the webinar from last week. That request has been submitted, and so hopefully within the next 48 hours, it should be on the website as well. Next slide.
All right. So we're going to talk now about documenting services, a little continuation of the conversation we had last week. During this time, I mean, the point to get across is that the service provision and the delivery method is going to be different than when schools were open. So now it requires some flexibility, and it's compelled by the circumstances and not by a decision of the IEP team at this point in time. We do have an expectation that to the best extent you can, that you're working with parents, reaching out to them. I think that contact with parents is going to be key during this time period, and is probably the best time spent, is just making sure that everybody's on the same page, that they understand how the child will receive their specialized instruction, what methods are going to be used, and are collaborating with the parents about that. Back to slide a little bit. Got a little trigger happy there. And then if you can, at times, there may have to be contingency learning plans set up, depending on whether circumstances change, and kind of anticipating further orders from the governor. But at the end of it, the idea is to have a clear communication of what the plan's going to be after working with the parents, and also to establish what barriers they have. So at this current time, you may be attempting to deliver specialized instruction and related services, but there's been some difficulty with respect to certain kids. It is important to kind of keep that level of contact open, and to not just say, well, we tried, but it didn't quite work out. If there's something specific to the child or to the parent, to at least make efforts to see what the barriers are and see if they can be eliminated or addressed, and then note those contacts. All right, so this, we are putting together some sample PWNs. Becky will be sending those out by email by the end of this week. We're just working on some of those, just so you can take a look at some examples. Once again, they're going to be sample ones. They're not designed for any specific student. They're all make-believe. So you do want to use individualized statements as you would in any circumstance that meets the needs of the specific student, but we did want to give you some examples, and some of the language is applicable across students. But the PWN samples we have would only have the 4 sections that are listed here. The expectation is that you would continue to use the statements that are included in PWNs regarding procedural safeguards and rights. And then the section also as to where parents can get additional assistance, and districts have pretty much set that up based on location around the state and the available resources at that time. And these are just some questions to consider as you're thinking about the actions that are proposed in this particular time period where the schools are closed. So things that you should be thinking about are the students' access to the opportunities that are being provided to all students. How is the consultation with the parent taking place? Is it by phone, by email, by text messaging? How will the progress of the student towards annual goals be measured during this time? And any adjustments that are being made. Also, why the action is taking place. Obviously we're in the midst of a pandemic. We've never seen this before. So we're dealing with the current situation and the circumstances, and then saying that we've moved to ways of providing instruction that allow for social distancing in order to promote the health and safety of all involved. And then if there's other options that have been discussed with the parent regarding implementing the IEP during this time period, those should be noted. And if some of them were rejected, the reasons for not pursuing those options would be listed as well. And then the information utilized, we'll give some examples, but you know, a lot of them are the same ones we've always used when making IEP decisions. Of course, you want to see how the child is doing, their present levels, their the emergency plan of the district, and also parent input, and whatever other progress data you have available to you. So once again, these are just food for thought as we give you the samples. Becky?
And we've had the question about should all students have a PWN? You need to document how you are consulting with parents during this time, how you're providing services, and we are not requiring this, but we are suggesting that this may be the easiest and best way to have your teachers document the consultation with parent, any changes in service provision methods, and just overall documentation at this point. A quick reminder about evaluations, reevaluations, and IEP meetings, primarily annual reviews and things. Eligibility determinations for both initial evals and reevaluations can only be made if all the information that was requested during the reeval planning meeting has been gathered and completed. On one of the national calls, we had understood from some folks that districts were being given advice to go ahead and try to complete eligibility determinations or reeval determinations, even if all available information was not there. And so the national TA centers have weighed in on this and said that it's been made very clear to us that you cannot complete an eligibility determination if you don't have all of the information that was requested by the planning team. So just a reminder about that. Okay, next slide. We've had lots of questions about contract employees during this time. Some of them I hope I addressed with the telepractice information, that it should not be a licensure issue for OTs, PTs, SLTs to provide services via virtual means. You probably have some contracts with outside agencies for various and sundry things, whether it's related service providers, or it might be school psychologists, it might be interpreters, school nurses. During this time, try to be flexible in looking at how you use those contract service or contract employees so that they can fulfill their contracts. For example, you may not have, because we're not doing instruction in a classroom, you may not have an interpreter stationed in a classroom providing interpretation of instruction, but the interpreter could work with the special ed teacher on access issues for students who are deaf and hard of hearing, or the interpreter may be providing interpreting services virtually while the student is accessing the gen ed instruction. With your paraeducators, have them during this time maybe participate in some virtual professional development activities. The IRIS Center out of Vanderbilt has some great modules on high leverage practices, for example, that could be used by your paraeducators during this time, and it would give them a chance to kind of further their knowledge. And again, if you're looking for different ways to fulfill contract terms. But do be aware of the terms of the contract, because all of your contracts will have been negotiated based on your district terms and requirements. So although you cannot pay for services if there are no services available or no services being provided, you cannot pay for services that aren't being provided. Try to be flexible in looking at how those services could be delivered during this time, and what services are needed at this point. All right, here's the good news, or at least we view it this way. The National Association of State Directors of Special Education, fondly referred to as NASD, and the Council for Administrators of Special Education through CEC, CASE, have issued a joint letter to the Office of Special Education Programs in DC. They have requested some flexibility, and the areas of flexibility that they've requested are in the area of timelines, procedural flexibility, and then some fiscal flexibility. They made very clear in the letter, and I will share the excuse me, I'll share the letter with all. They made it very clear that they are not asking for waivers. They are not asking to have any rights under IDEA done away with. They are asking for flexibility that would be temporary and targeted. And that's the phrase they're using, temporary and targeted flexibility. With timelines, they are asking to have some flexibility with the 60-day evaluation timeline and the reevaluation triennial dates, with annual review timelines, with complaint timelines, and with the C to B transition timelines. So our BabyNet to Part B timelines. Of course, anything, as we've said before, if you can gather information during this time in other ways, or information that you can gather means other than face-to-face, go ahead and do that. But they are asking for this temporary targeted flexibility with 60-day initial evals, re-eval triennials, annual IEP timelines, and then the complaint timelines and transition from C to B. The letter does very clearly talk about any meetings that can be held via phone, computer, electronic means. Go ahead with those, but anything that requires a face-to-face meeting, number one, could not take place, and number two, not all of our families or even schools have access to technology that would allow for meetings to take place in a manner other than face-to-face. In the area of procedural flexibilities, they are asking for flexibility with the documentation of FAPE under each district's unique circumstances. In other words, we know that when a decision is made to change a student's placement, that is an IEP team decision that gets made, and the IEP team, of course, includes parents. In this situation, however, the decision to change service delivery, to change services, has been forced upon parents and schools by the pandemic. So the two groups are suggesting that all IEPs written before schools closed be maintained. If there are changes that need to be made in service delivery methods, that they be done through some type of distance or continual learning plan rather than an IEP amendment. And so the plan, and this is what we've talked about with the prior written notice, that would be how you would document it. The plan would clearly communicate that after consultation with the parent, this is how the team has chosen to provide practical and reasonable access to instruction and services under the IEP. So the point that the two groups made was that this is not a situation that IEP teams, schools, or parents have chosen to face. It really is a situation that is very atypical, and that when IDEA was written, none of this kind of situation was not taken into consideration. I don't think anybody in their wildest dreams really thought we would be facing a pandemic of this magnitude. The other area under procedural is data collection and corrective action. This flexibility would allow states and districts to focus on providing services and access rather than on corrective actions and paperwork. And we talked last week about the fact that you have our assurance that that will be our focus, that we really are focusing with you on how we're providing services and access at this point, rather than on the corrective actions or paperwork required. All right, the last part of the flexibility had to do with fiscal flexibility. And I know that these 3 slides are difficult to read, but I wanted, because of the superimposed proposed, I wanted to make clear that anybody who might happen to pick this PowerPoint up cold would not think that these things were already in effect. We were not given a timeline, although we were told on our call yesterday that OSEP has been extremely quick with their reactions. They have developed a rapid response team, which some of us found a little oxymoronic with the use of that term with OSEP, but I will say that they have been incredibly responsive throughout this situation. And so the two organizations, NASD and CASE, were both very hopeful of getting some information or getting some responses soon. So the last area of flexibility would be with fiscal management, and that would have to do with local maintenance of effort, and then proportionate share for parentally placed private school children for the rest of the year, and then the Comprehensive Coordinated Early Intervening Services, CCEIS, set aside. I will forward the letter to you so that you'll have it. Again, these are being asked for, and the only with targeted time limited flexibility as it relates to the specific circumstances of the COVID-19 pandemic. All right. Next, okay. Just sort of a reminder at the end, and I'm going to kind of scroll back through the chat as I talk, or I will try to. If you will get in the habit of checking the frequently asked questions on our website, or the responses, we are updating those at least weekly, typically on Fridays. If you will try to go there to see if your question's already been answered before you submit, but if it hasn't, please continue to submit questions through the link. Unfortunately, at this time, we have no more information, and as we said last week, we cannot begin to talk about compensatory services or additional services that might be needed, or extended school year services at this time. We just don't know how long this closure will go on. and we don't know what the impact will be to students. As quickly as we get answers to some of these questions, we will post them and send them on. At this point, if you are holding an annual review because you already have all the information you need. Now, again, annual reviews are just like initial evals and reevals. You can't hold an annual review if you don't have all the information that you need to review progress over the previous year and then to write a new IEP. Now, if you already have all of that information, you can hold the annual review remotely, but you cannot hold the annual review if you don't have everything that you need. Because even though you might say, well, we're meeting the timeline by going ahead and holding part of it, if you don't review previous performance and then write the new IEP, you've not held a complete annual review. So watch that kind of thing. Again, this is one of the asks from NASD and CASE, is that we be allowed flexibility with this kind of deadline. Let's see. So one of the things that we want to do with the survey is to help figure out who solved some of these problems already, like with remote access. Do we have districts out there that have kind of solved the remote access problem? Do we have districts out there that have gotten creative in how to ensure that kids with disabilities have devices? Some districts, for example, have provided one-to-one devices for 3rd grade and up, but not for their kindergarten through 2nd grade. This is where we are encouraging you to look at your current use of IDEA funds. This is where we hope to very soon make some additional funds available, so that you might want to try to put devices in the hands of your kindergarten through 2nd graders, or you might look to see how the buses that have the Wi-Fi that are being stationed at different places in the communities could help access these kinds of services. I was trying to think of any other, with your questions, if you have specific questions like what are other districts doing for so-and-so, please submit those kinds of questions as well, not just questions about when will we know about additional services, or when will we know about ESY funds, or those kinds of things. But if you've got areas that you've got specific concerns in, please submit those through the FormStack link as well, so that we can start helping to link you with districts that may have taken a step further down the road than where you are. I think that's all I have for this week. I hope that everybody is safe. I can't encourage you enough to try to look after your own mental health and sanity at this point. I think I said last week that as ready as I thought, or as well equipped as I thought I was for this type of work, I've had difficulty adjusting, and it really, you will be so much more effective if you can take a little bit of time to look after your own self, your own family, even if it's just disconnecting for a couple of hours. Everything will still be there when you log back on, when you check back in, and just know that you're not doing this by yourself. We are all in this together. If you have extreme situations that occur, pick up the phone and call us, email us. I will say, let me back up with that. The easiest way to access us at this point would be through email. But don't hesitate to shoot an email off to me to say, we've had this one situation that's just really weird. Can we talk through it? That's what we're here for. And as John said, we will all get through this. And we'll, I firmly believe that we'll be in a much better position, not just to provide services for kids with disabilities if this ever arises again, but I think we'll be in a much better position to provide sound services, period. I think this is an opportunity that we have all embraced to look at things differently, and I think it's clear to everybody out there that we are trying to put the needs of our students first and foremost. And I'll close by saying, but the only way we can do that is to look after ourselves as well. All right, I appreciate everybody's time. And again, don't hesitate to reach out, please. And we will talk again next week, if not before. Thank you.